Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting listening test part B. Tips, tricks and the techniques. Yeah. So, 6 questions. So, we have 6 questions here. Yes, get ready. Take your notebooks, note down your synonyms and everything. Yeah. So, this is the first question. Go through this question carefully. So, find out 5 words from each sentence. 5 words. So, 5 words. What are the important words? 5 important words. And the most important word among these 5 words. Okay, first, find out the most important word in the question. Most important word in the second sentence. In the second sentence, what does she warn her colleague about? What is the most important word? What is the most important word according to your point? What is the most important word you think? Write down in the chat box. The most important word which rules this question. Which rules this question. When I tell you I am giving the tricks, I mean it. Yeah, I have joined from my mobile, so I'll be watching your points there. Yeah. So there are 5 students who have written one. Okay, so one is the most important word. Yeah, this is the king. You're absolutely right. You are absolutely right. This is the king of the question. One. Yeah. So this is the most important word. So warning. I will ask you one particular question here. When you say warning, why do you give a warning? Why do you raise an alarm? Warning is raising an alarm. Okay, ring the bells. Ring the bells means cautioning. Why? Why do you warn somebody? So who will warn and who will be warned, and why is the warning given? Who will warn? A person who has a command will warn. Not everyone can warn. Not every individual can warn. Warning will be given to avoid some problem. So there is a problem. So you have to be careful. So you're cautioning. You're making the other person aware of the problem because the other person does not have any idea. Yeah, come on, participate. I'm giving you cheat codes. I'm giving you cheat codes, secrets. Participate. Seriously. Oh. Yeah, cheat codes. Warning, ringing the bells. Okay. So some danger, impending danger. So there is some impending danger. There's a danger which is going to happen if you ignore, if you do not take care. Yeah. So you are warning the other person because he is not aware. A person, remember here, you'll give a warning. On what grounds? You'll give a warning on what grounds? So there is a danger. A person who knows that there is a danger and who knows the complications or the consequences. So he will tell the other person who does not know about it to take care of it, to prevent it, to avoid the dangerous consequences from falling on that particular person. So, if you understand this word warn, that means you are the king. Okay. Now, this warn is the king. A king means a superpower. A king means a superpower, and a person who can control the king is the emperor. A person who cannot understand the king is a soldier or an ordinary person. So you want to be an ordinary person, or you want to be a king, or you want to be an emperor? That is on you. It depends on you. When you try to play the game masterfully or playfully, as if you are a champion, you're a champion. Okay, you are not a player, you are a champion. A player plays, a novice panics. A player plays, a champion gives master strokes. Remember, you are with Grand Master class. Never expect the mediocre things from Grand Master class. So if you want to be a champion, you control the king. Then you will become the emperor. A champion controls the players. Okay. So that's it. So warning will be given to prevent an impending danger. This is the cheat code. So you are ruling the king itself. You are not ruling the ordinary people, you are ruling the king itself. So warning, warning of some danger, warning of some problem, warning of some problem. Now, this king has three ministers, and one minister is going to unlock the lock behind this question. What does she warn her colleague about? So she warns, the lady is warning the other person. There will be two voices, a male voice and a female voice. Okay. Now let us study the meaning of this word warn. Now, warn is an action. It's an action. When you're warning, so you are warning somebody because you know everything about it and the other person does not know anything about it. And what is that? That about what? About something. So about something. You are warning about something or about someone. So definitely something or someone is a noun. So what is that noun? The question is focusing on a particular noun. So a nurse is warning her colleague who is a nurse too. So now here you can see the background. You can see the background. Now if you want to see the background, you hear a nurse briefing her colleague about a patient. A patient. A nurse is briefing her colleague about a patient. Why? Because the other person doesn't know. So that means about this patient, the new nurse, the colleague does not know anything. So now let us build the background of it. A patient was admitted, and this nurse is transferring her responsibility to some other nurse. If she is handling the case, there is no need to warn somebody because she is only going to handle the patient. So that means the handover is happening. The background, you have to imagine the background, then you'll get goosebumps. You'll get goosebumps. You're imagining the realistic situation. So you are the nurse and you are handing over the patient, the responsibility of the patient. So outgoing nurse is handing over the responsibility of the patient to the incumbent nurse. So one nurse is going home after duty and one nurse is joining duty. And the responsibility, the charge is shifted from the outgoing nurse to the incoming nurse. So when passing on, she's telling everything is fine except one particular thing. That is why she is warning. There are three options. There are three things which she is going to discuss. And she is going to warn about something. About what? About one particular thing. One particular thing. If she is going to warn about one particular thing, this one particular thing will be in either A or B or C. Only one particular thing is the problem. And she's going to discuss about three things. And if she's going to discuss about three things are important. But one thing is the most important because the king is playing the role, warning. So only one problem is there. So out of 3 points which she is going to discuss, 2 things are out of problematic zone. And one thing is it's a persisting problem. It's an ongoing problem. And the 2 other things were also problems, but they were ruled out because they were solved. And one problem is still unsolved because it's an ongoing problem. So because it is ongoing problem, the problems taking care of that problem is shifted. Try to understand this. So there are 3 offshoots. There are 3 offshoots, a trident. So one point will pierce. So you have to find out what is that one particular thing. Warning about this, or about this, or about this. So he's talking about 3 things, but about which she is warning, which particular point, A or B or C. Now we are going to the offshoots. We are going to the offshoots. Yeah. Now, if you see here, yeah. So she is warning about three particular things. The patient is allergic to some types of antibiotics. So allergy is there. Allergy is there. There are three nouns in this. The patient is allergic to some types of antibiotics. So there are four nouns. Patient, sorry, three nouns. Patients, allergic, transform into noun, it's allergy. Some types, type, and antibiotics. So there are two important words here. Patient is everywhere. Patient is everywhere. It's commonality. How are you coming out to exclude these words? You are eliminating. The patient is unimportant because the patient is everywhere. First time when you talk, you will say a patient. But next time when you repeat, you will say the patient, the patient, the patient. You can see. And the second time it is coming, you will say the patient, the particular patient. When you are introducing the patient, you will say a patient. But when you are repeating, you'll say the patient, the patient, the patient. Remember that. A becomes the here. So this is ruled out. The patient, the patient, the patient ruled out. Now, if you check now, allergic, some types, antibiotics. Allergy is not a problem. Allergy is there, it is not a problem. But when you take those antibiotics, this allergic reaction happens. Allergy is there in his body. It is already there. The body doesn't accept this antibiotic. The body doesn't accept this antibiotic, that is allergy. Allergy is always there. Throughout his life, it is there. Throughout his life, it is there. But when he takes those antibiotics, then problem is there. Okay. So you're not going to give those antibiotics. Try to understand this. So here antibiotics is the problem. Don't give these antibiotics because he is allergic to them. So antibiotics is the problem. Or a types is the problem, allergy is the problem, or patient. What do you think in A part is, what according to you is the most important word in part A, in a text, option A? Most important word in text A. Come on, tell me. Now, give me your answer. What do you think is the most important word in text, option A? Allergic? Do you think allergy is the problem? Antibiotics. If you don't give these antibiotics, no allergy. Don't give these antibiotics, no allergy. Why allergy is the problem? Why allergy is the problem? Allergy is there. You give these antibiotics, allergy is there. Otherwise, no allergy, right? Allergy is closed box. You give these antibiotics, you will wake up the sleeping tiger. That's it. Allergy will be endemic. Nothing is going to happen if allergy is there. But you give these antibiotics, then allergy comes. So antibiotics are the problem. So be careful with these antibiotics. That is he's telling. Yeah, antibiotics. The next one, in the second point. So is he warning about antibiotics? Sorry, is she warning about antibiotics? Number two. B, care must be taken to prevent from falling. Now, in this one, What is the problem? Care is the problem, or prevention is the problem, or falling is the problem? Which is the problem? Very good. You are wise people. You are going to become, okay, from novices, you are becoming players, and from players, you will become, okay, champions. So falling is a problem. He may fall anytime because his body is miserable, his body is weak, his body is not very strong. Okay. So he'll fall. He will fall. Chances are there to fall. Okay. Fall anytime he may fall. So always you have to be on guard. Next one. And C. Oxygen may be needed if the patient becomes breathless. What is the problem? So convert the verb or noun in need, oxygen, breathlessness. Which is the problem here? Becomes breathless means breathlessness. So which is the problem here? So breathlessness. Right. Is she warning about antibiotics? Or is she warning about falling? Or is she warning about breathlessness? Yeah. So this is how you have to identify. Now here, focus on these particular words. I'm going to play the audio now. You have to focus on these particular words. Right. For example, okay, he will say has no known allergies. Maybe no allergies, not allergic. It may be anything. Okay. It may be anything. It may be anything. Right. So think about these words. How to analyze these things. The patient is prone to fall. He is weak. Okay. And breathlessness, oxygen may be needed if he becomes breathless. So now this condition may be controlled or may not be controlled, which is the natural thing. Antibiotics can be controlled, falling can be controlled, breathlessness can be controlled, but which is more vulnerable? Regarding this one, which things you can control and which things you cannot control? You have to analyze. Antibiotics. If you know that he is antibiotic allergic to penicillin, you will not give penicillin. That's it. But falling, because antibiotics you will be giving. So anytime you can control. But falling, how can you control every time falling? He may stand, he may sit, he may move. So falling. Breathlessness. So if a person is breathless, you will give something, treatment, you will give. So antibiotics is a treatment, breathlessness, you will give some treatment or you will manage. But falling depends on the person. Okay. Whatever you do, so give. Most serious problem is what? Antibiotics, you can 100% control because you will not give antibiotics when you know that it is allergic. Breathlessness, you know that emergency is there and you'll give something and you'll care. But falling 24 bar 7, anytime he can fall. Chances are there. So like that. So you have to see which is more vulnerable area. Okay. Falling, he himself has to do that. Every time, 24 hours, all the time you cannot be there. All the time, he cannot be there. That's it. Okay. That is the point there. You have to remember. Now I'm going to play this audio.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking.
Yeah. Now you can submit your answer. 7, 6, 5, 4, 3, 2, 1, and submit. Yes. Right. That's the secret. Okay. So it's a one-sided. Okay. Now let us see whether we win or lose. Let us check our answer. Yeah. So, question number. Okay. Now, what is the answer here? The answer is, the correct answer is, yeah. The correct answer is, yeah, here is the correct answer. Yes, it is the correct answer. So what you are supposed to do is, you have to, yeah, make it a circle like this. The correct answer is B. The correct answer is B. So those who have got the answer, write one by one. Yeah. Now, yes. Now let us discuss this point. So these are the secrets which we have to learn. Did you learn any secrets? If you learned some secrets, what are the secrets you have learned? Let us analyze what are the new things that you have learned, because these things which you have learned, you have to apply. So who is the king? Find out and become the emperor. So the most important word in the question is the king. Okay. And the enemy is there are three enemies. The enemy king is one. You have to go and hit that king. That's it. What are the points that you have to discuss? So here, the first point, what I can tell you is, you have to visualize the background story. Okay. Who is speaking? To who, with whom is he speaking or she speaking? And what is the intention? What is the intention? The speaker and the listener and the subject matter. Now here in this subject matter, then the question comes. Okay. So the most important word here in this particular question is warning. Now this warning, you have to think about it. Why does a person warn? To avoid some danger. So what is the danger? So she is going to talk about 3 points. And what is the danger? Which is the danger? Which is the problematic thing? And you have to eliminate which are the not problematic things. Then you can find out. Now give your points what you have learned. The secrets that you have learned. Yeah. Right. That's the secrets you discovered. Yeah. Write the secrets that you discovered. At least 1 point you might have learned. No? Everyone write 1 point, then you'll get everything there. Come on, write down your points before we go to the next question, because these points. Yes, very good. Good points are coming. Critical thinking before selecting the answer. Selecting appropriate keyword. Keyword. Elimination technique is one word. Elimination technique. The words which are repeated in every option is eliminated. Use the elimination technique to reduce the unnecessary information. Use the elimination technique. Or identify the commonality. Identify the commonality factor. So I'm giving you the points. So for part B, you need critical thinking. Yes. Now we shall go to the second question. Yeah, this is the second question. You should know that there will be two voices, one male and one female. Okay, you hear the manager of a core home for the elderly talking to the nursing staff. So male voice. Whenever you see the word he, that means male voice. Yeah, go through this question now. So you hear the manager of a care home for the elderly talking to the nursing staff. So care home for the elderly, that means old people. Old people are there. And it's a care home. And the manager is talking to the nursing staff and he's telling, so every question means problem. Answer means solution. So there is a problem and you have to find the solution for that. So everyone is a question. Everything is a question. Question means a problem. Okay. Now what is the problem? What is the kingpin here? Here you need to find a king and a minister. So what is the most important word? What is the most important word which tells you that it is a problem? What is the problem here? Yes, that's awesome. 1, 2, 3, 4, 5, 6. So, yeah, the most important word here is errors. Errors is the king, and this king has a minister. What is the other word which you think is the most important word? Patients not problem, medication to patients not problem, distancing medication to problem also is not a problem. Now what is the other word which is going to help? One more word which is going to help here. The king along with its minister. We are unraveling another code. Result is not a problem. Result is not a problem. In the question, he says that errors in dispensing medication to patients usually result from. What is the word? Identify that word. That is the secret. If you can identify this, that means you are a winner. You are a winner. Wow, very good. Usually. Come on. Is usually the right word? No, not right. Usually is not right. Yes, Avil has given the right word. Errors from, you should know, errors are coming from where? If you know this secret from where it is coming, then you can solve. Errors are coming from. Errors from where? Errors from where? Where is here? From here or here or here? Errors from where? Avil, very good. So errors from where? Then you can block them. Usually is not important. Result is not important. Errors only result. Result is errors. Okay. Result is errors. So what is the reason for that one? So you are finding reason. This is cause and effect. Error is the effect. Error is the result. Error itself is result. Because of some reason. Cause means reason. Reason and result. That's it. Errors from where? So this is a right. Errors from where? From here or here or here. So now errors from where? Now A. Now check out A. The most important word in A. Come on, write down. Is interruptions important? Is interruptions important? Interruptions when or while what? While calculating. Calculating what? What is the end product? Where will you go and stop? Yes, dosages is the problem. If you calculate dosages and some interruption is there, some wrong is there, then yeah. So wrong dosages. Wrong dosages happens when interruptions are there. Okay. So interruption from dosages. Yeah, that's absolutely fine. Interruptions, errors result because of dosages. Okay. Errors from dosages. Wrong dosages. Wrong dosages. Why? Because of interruptions. So when dosages are calculated, you should not interrupt. So interruption is not important. Dosage is important. And while doing dosages, interruptions are important. So be careful. That's the point. So the point is going like this. From dosages because of interruptions. Errors from dosages because of interruptions. See this. See this angle, how it is going. Okay. Right. So next one. And the next question in B. In B. In B. Yeah. What is the next word in B? Yeah. So from allergies. Okay, let us take allergies. So from allergies. Allergies because of failure to check. Failure to check. Not checking. Allergies unchecked. Allergies unchecked. You can see the role, how it is going. Allergies because it is not checked properly. Improper checking. Unchecked. Allergies unchecked. Allergies unchecked. Failed to check. So unchecked. So this is the root. Allergies unchecked. Failed to check. And the next one is C. In C, what do you think is the most important word? In C, what is the most important word? Late in the day. Kamal Takar, late drugs. Early, late. Early means morning, late means afternoon and evening or night. Yeah. So drugs. Drugs late. So yes, from drugs because they are given late. So errors from drugs because they are given later part of the day. Okay. So these are the three things. So you have to focus on these three particular things. So now we are going to listen to this. Think about the dosages. So disturbance, right? This is not checking properly. This is later part of the day. So remember these points. Yeah. I'm going to play the audio now.
Paracetamol for minor pain with good results. She has an 18 gauge in her left arm.
Yep.
She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Question 27. You hear part of a morning briefing on a
Yes. Now you can submit your answer, A, B, C, D. Yeah. So Right. Now the correct answer is yes. I'm going to give you the correct answer for this question. 26. Yeah. A is the right answer. So those who have got the mark can put 2 by 2 or 1 by 1 or 0 by 1. Kamal Thakur, Vinita, Avil, 2 by 2. What about the others? Next, third question. Go through this third question, please. Study the question. You hear a part of a morning briefing on a hospital ward. What is the plan for the patient today? So, patient, there is some problem. So, for that one to solve that problem is a plan. A plan to solve the problem. Patient itself is a problem. Patient itself is a problem. So, you have to solve the problem. So, there is a plan. You are devising a plan to solve the problem. Okay. So problem is there. To solve the problem, there's a plan. So what is the plan? Plan to solve which problem? What problem? Plan for what problem? For the patient today is nothing important. Plan for what? For what problem? So which is the most important word here? In question number 3, which is the most important word you think? One word. I want one word. So when you say plan for today, yeah, that means yesterday was there, today is there, tomorrow is there. So something may be of yesterday, something is today, something is tomorrow. So today is important. But the thing is, what is more important? Today what? Plan. Plan. Yeah, that's absolutely right. What is the plan? What is the plan? So plan for what? Plan for what? What thing? What means again noun? Plan for what? Plan for what? What is that? So, is it regarding her emotional state? Emotional state, emotions. Emotional state means emotions. Or is it she'll be transferred to a more specialized unit? That means this is not specialized unit. So transferring to a more specialized unit is the problem. Or a social worker will come and see what help she needs. A social worker will come to see what help she needs. So help is the problem. Her requirements are problems. So social worker will come. Nobody can help. So social worker will come and help her meet the requirements. Okay, needs. So mental condition is the problem, or the surroundings is the problem, or physical condition is the problem. You have to focus on these three things. Now, if you see very carefully, yeah, her emotional state will be carefully observed. Emotions means mental. She has some mental problem. She has some emotional problem. She has some emotional problem. So mental state, mind is problem. Her mind is the problem. She will be transferred to a more specialized unit because this unit is a problem. This unit is an ordinary unit. So special unit. So unit is the problem here. She is not getting special care. So unit is the problem here. So ordinary unit to special unit. Her mental state will be carefully observed because her emotional state is not a standard. Okay, emotional state is not perfect. Imperfect emotional state to perfect emotional state. So that is the problem. The next one, a social worker will come to see what help she needs. She needs some help. She needs support. She needs what? Help. So plan for help, or plan for unit, or plan for mind. So plan to improve her emotional state, plan to change the unit, plan to make her emotional state strong, plan to change the unit, plan to help her. So today, what is it? So these are the things that you have to focus. Now listen to the audio.
and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay, I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We will consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation.
Yes, submit your answer. Yes. Now let us check your answers. So majority of have written A and B, and C is also there. Okay. Right. So multiple. So it's a confusing question. Okay. Now let me give you the answer. Yeah. The answer for question number 27 is A. So the answer for question number 27 is A. So you have to make it black like this. Remember that. Okay. So how many marks you got? Right, 3 by 3 or 2 by 3 or 1 by 3 or 0 by 3. Yeah. Then next question number 28. I'll explain these questions further using the script. Yeah, go through this question carefully. You hear part of an antenatal consultation at a GP practice. What does the patient want to know about? She wants to know about something. She wants to know about something because she does not know about it. That means she is ignorant. She lacks knowledge. Lacking knowledge is a problem. So she wants to have a solution. So that's why she wants to know. She lacks knowledge. Know about means she wants to know because she does not know. She wants to know about something because she does not know about that particular thing. So she wants to know about what? She knows about two things, but she does not know about one particular thing. So what does she want to know about? Because she lacks knowledge. Ignorance is the problem here. Ignorance is the problem here. So she wants wisdom about that particular thing. She lacks knowledge about that. So she wants wisdom about that particular thing. So what is that particular thing here? Advisability of home birth. She does not know about home birth. So that's why it is a problem. Home birth. Home birth. So she is going for giving birth. So home is a problem. Okay. The word birth at home. Okay. Here, what is the most important word? Know about. No, she does not know. She wants to know because she does not know. She wants to know. So knowledge is the problem here. Know about something. about something. Know about something. What is that something? So what is that something? What is that something which she wants to know about? Okay, right. About what? About what? Is it regarding birth at home? We know that it is birth related things. So home, birth at home. So she wants to ask, okay, ways of avoiding postnatal depression. So postnatal depression is her problem. So she wants to know how to tackle depression. If it is first time, then it is depression. If it is second time, maybe she already knows that. Okay. Next, what painkillers might be available during labor? Painkiller. She doesn't know about painkillers, so she wants to know about painkillers. So pain is the problem. So painkiller is the, she does not know anything about painkillers. So she wants to know about painkillers. She wants to know what? She wants to know what? She wants to know about home birth. She wants to know about depression, how to avoid depression. Then she wants to know about pain, so painkiller. So regarding what? So what does she want to know? What is she communicating here? Now go through this. What might be the related words? Yeah, I'm playing the audio now.
Clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Question 29. You hear a trainee doctor telling his supervisor about
Yeah. So you can submit your answer. So it is majority of you have written C. Yeah. Now let us check the answer. Yeah. So here you have to focus on the most important area. So the answer to this question is so C. Answer to this question is a C. So update your scores, please. Next. Question number 29. Go through the question. You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. So the problem, the trainee feels the cause of the problem was. There's a problem. There's a problem here. And the cause was what? Cause was something. So the cause was something. Cause was something. Cause was something. What is the cause? Cause was something. Treatment administered previously, which is the most important word here. Treatment. What was the cause? Treatment. Now, the patient's negative reaction. So the patient is problem because he is giving negative reaction. So patient is the problem here. Patient is the problem because he is giving negative reaction. Reaction is not problem. Patient is the problem here because he is giving negative reaction. Inappropriate equipment. Equipment is the problem. So which is the problem here, do you think? The cause, treatment was the cause. Patient was the cause for the problem, or equipment was the cause for the problem. So treatment was the cause, patient was the cause, equipment was the cause. Now focus on these 4 words. Focus on these 4 particular words. Yeah, I'm playing the audio now.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Question 29. You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, she endured it without a murmur. I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Question 30. You hear a doctor talking to a teenage boy who...
Yeah, submit your answer, please. Yeah, most of you have written answer A. Okay, now let us check the answer. All of you, submit your answer. Yes. "29". The answer for question number 29 is, yeah, 29. "29" is A. The answer for question number 29 is A. Because he did not say anything without a murmur. He did not grumble. That's what he told. So update your scores. Next, last question. You hear a doctor talking to a teenage boy who has a painful wrist. The doctor wants to establish what? The doctor wants to establish what? The doctor wants to establish what? So what is the most important word here? Is establish. Establish what? Establish what? Whether it is a fracture or more than one fracture or no fracture. A fracture may be misaligned. So one fracture. A fracture may be misaligned. So one fracture. More than one bone means more than one fractures. Due to a sprain means not fracture. Not fracture. One fracture, zero fracture, one plus fractures. This is one. This is no. That is zero. This is more than one. So it is 1 plus. 1 or 0 or 1 plus. So this is the difference. You have to understand how to analyze the question. One fracture or zero fractures or more than one fractures. 1 plus. 1 or 0 or 1 plus. Okay. Now that is establish what? Establish whether it is 1 or 0. Establish whether it is one fracture or it is zero fracture, that means sprain. It is more than one. 0, 1 or more. That's it. You have to understand the secret behind it. Then only you can analyze the question. Open up your mind for everything. So 0 fracture or 1 fracture. First one, A is 1 fracture. B is not a fracture. It is a sprain. That's all. So 0 fracture. And third one is more than one bone affected. Means more than one fracture. So I'll play the audio for you now.
Well, I'll supervise you the next time you do it.
Question 30. You hear a doctor talking to a teenage boy who has a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right, well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you describe. I can't feel any other fractures. But you'll need an X-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
Okay.
Yes, submit your answer, please.
That is the end of Part B. Now look at Part C.
Yeah. Let us check the answer now. Yeah. The answer to this question. Yeah, submit your answers, all of you first. So, A is the right answer. A is the right answer. So, submit your scores, all of you. Yeah. So, how was the brainstorming session before each question? How were the brainstorming sessions before each question? Okay. How are the brainstorming sessions before the questions? Before every question, there was a brainstorming session. We try to understand, analyze the questions. How are they? And I want your feedback, whether it is beneficial for you or not. Shakirat, close your video. Give your feedback, please. What you learned, how it was for you. Yeah. Yes, sir. If anybody is interested, you can give your comments, how you were facing difficulty earlier and how you are able to improve. So we have Dalvi Yogendra, Jayantini Suman, most probably from Sri Lanka, Jayantini Suman, Simiat Abdul Rahim from Nigeria, Habibullah Sani from Nigeria, Hafza Fatima from the UK, Rajeshwari from Pune. Then Mansi from Maharashtra. Then Rifa from Bangalore, and Kamal from Ludhiana, and Srija from Kuwait. So all of you can give your feedback. Yes, please. If you increase your pace, then you will get only don't think you'll still there are a lot of things to learn. You have to match many other things. Yeah, I can increase the space, no problem. But instead of learning 100 questions, learn very nicely, na? Some questions. At the end of the session, you will not get anything. So what is the use? You have to understand the secrets. Anyhow, you are doing. Yeah, you can practice more sessions, na? After doing this one, you can go and practice. These techniques you can practice with other questions. Yeah. Yeah, from morning to evening, you can practice all of you. Yeah. So no problem. What we can do is we can 2 questions. Actually, I teach only 2 questions per day, but we have done 6 questions. So think about that. Okay. So that's better, no? Instead of just running fast, learning 2 questions perfectly is better. I thought of taking 2 questions for listening and 2 questions for reading. But good, we have done all the 6 questions. So part B is done. So tomorrow we can focus on part C. So go and apply the same techniques, na? Apply the same techniques in all the questions when you are doing. Everyone. Yes. So regarding the new students, just I want to have a quick feedback. Yeah. Hafsa Fatima. Afsar Fatima. So I'm opening for everyone. Yeah. You can share your opinion. Then there is Dalvi. Dalvi, can you speak? Because you had problem. You requested me, sir, part B. So you can speak. Otherwise, you can at least write in the chat box. Yeah, Rifa. Rifa is also a new student. Yeah. So that is the end of the session. So tomorrow we'll do part C, listening. Have a nice day. Thank you for your valuable feedback. Good night.